this is the second part of the discussion for this session, and I will discuss the two remaining papers: the Sara Yamalabadi paper on quality of care and quality of care in hospital settings, and the second paper by Rucha Badia and Catarina Blancard that is on regional innovation systems. I'm Giovanni Fattore from Bocconi University. I was part of the consortium, and I had the opportunity to listen to the presentation. Now, about the first presentation by Sara Yamalabadi, it's basically based on two papers. One is a systematic review of the relationship between cost and quality in hospital care, and what is basically found is that there's not a systematic evidence in this respect in the literature. So we find papers where there is a positive association and paper where there is not a positive association, and it seems that we cannot really find any specific regularity about quality of care and cost. And also, I think it's important, it highlights as very often costs are measured in terms of tariffs or price that are generally set. So it's not really a cost quality analysis, but it's more an issue of price and cost and quality analysis. And so my first intuition is that we should try to correlate not so much quality of care with cost or prices, but basically to the difference between prices and cost. And probably the real issue for healthcare organization is how much the funding system put pressure and does not allow to use the best equipment to work in the best conditions with enough stars. And the critical issue here, in my opinion, is really to try to work, if we want to compare hospitals, to try to work on cost and try also to introduce a new variable that is basically management quality, but both at hospital level and department level. So we expect somehow that good management make possible to provide a higher quality of care with given resources. The second part of the paper conducts an empirical analysis on a major sickness fund in Germany, and shows some, at least to me, some bit surprising results, that basically the higher the competition, the higher mortality. So basically, for a patient with myocardial infarction who needs a LUT stent, it's better to be admitted in an area where there is not very much supply of hospital, rather than in a very competitive area where there is a multiple choice of hospital to be treated. Yes, indeed, this is coherent with some of the evidence from the United States, from Medicare, and it's also coherent with one of the first paper investigating competition in Europe by proper But I think it's important to remind that that paper is based on a different type of a competition, because at that time when she studied, and I think it was the case of myocardial infarction, uh, what he what he what he investigated was a system where health authority contracted with independent providers, volume of care, standard of quality as far as possible, and funding. So this was a different type of competition. So we may expect that from this type of competition, the pressure on providers from the purchasing authority may even result in some undergrade of, of, of so deterioration of quality. While instead, the German system is similar to the present system of competition in the UK, where basically hospitals compete for patients with fixed price, and this is similar to the Medicare system. My impression is that we really have to study more and to understand more what is the impact of competition on performance of hospitals. And then for sure, the two motivation found out the author supporting the empirical evidence of this paper are interesting, and basically what they say is that additionally forms of funding and subsidies may be available for hospitals that are in decentralized area and that are less under competitive pressure because I'm more in sort of remote area. And also for this reason, they may be better supported from other type of intervention and can make better dealings and agreement with authority about, for example, infrastructure. I would say that it's possible that other things are at play in this situation, and I think this paper is an interesting contribution to an important literature. We need to know more about what is competition in the healthcare sector and how it works and what type of effects it has. The second paper is by Rucha and Caterina Blancard, and is about regional innovation system. This is a rather different type of paper, as it tried to think about, I would say, spatial distribution of research activity and research outputs across Europe. And I think, again, it's made on two parts. The first part is really a part where they reconstructed the geography of the of funding and output of research for cardiovascular devices. And what it surprised me, and this is interesting, is that there is a clear uneven distribution of resources and outputs across Europe, where basically most of research activities is conducted in Western Europe. What is, I would say, surprising is that not only the lack of research in Eastern Europe, but also the modest amount, at least compared to other countries, of research in this area in Germany. And this is somehow probably further exploring. And then the author tried to assess whether there is a relationship between publications and two types of funding, or at least two modes to identify the amount of funding in different area, and they use as a reference area NAT 3 according to the European Union classification of regional area. In a first analysis, they correlate publication with grant reporting as stated by the authors in their publication, and in the second analysis, they correlate the number of publication to public funding according to the Horizon 2020 in terms of where this public funding was given in terms of territorial and geographical areas. Now, fortunately, this is something expected, but it's always interesting to prove it. There is a positive correlation between publication and these two types of funding, meaning that the more funding regions receive, the higher the number of publication. Here, I wonder whether maybe authors could have done a bit more, maybe try to see if there is what type of relation there is between funding and production in terms of publication. This could have been maybe try testing a nonlinear relation to see, for example, whether the higher the level of so basically if there is an advantage that organizations acquire over time, having more funding, that makes them more likely to publish. So maybe it could sort of suggest that concentration of funding in different area or different even organization may be beneficial in terms of productivity. So really to assess whether the relationship between funding and productivity is somehow curvilinear. The second point I was a bit surprised was the relationship between the relationship the association found between GDP and productivity, a number of publication, because if for one type of funding it was found a positive relation, and for the other was found a negative relation. This is maybe worth being explained. Maybe the mechanism for which resources are allocated strongly sort of creates different allocations according to territory. Maybe that's my guess is that EU 2020 somehow distribute resources in a more, I would say, more egalitarian way than grants that really go to according to specific projects and do not require sort of international alliance, and basically possibly, I would say, possibly do much less take into account the sort of the regional and national source of the application. An interesting paper on a very innovative issue. I think we desperately need more about regional innovation system, and also from a more normative way how to promote these regional innovation systems, maybe also to promote them in the area that are presently lacking these systems. Thank you very much.